Mr. Speaker, to the Acting Premier, I'm going to ask for her sincere consideration. I've been clear that the PC caucus will support a good idea no matter where its origin is, no matter where and what side of the legislature it comes from. Today, the Liberals have a chance to do the same. We've been joined by patients and their families struggling with rare disorders. They have travelled here today to show their support for the member from Kitchener-Conestoga and his motion to create a select committee to examine the enormous challenges facing the rare disease community. Mr. Speaker, will the government put their partisanship aside, recognizing this will help these families, this will help these patients? Will the government support the member from Kitchener-Conestoga in this important motion? Next.
Thank you.
Minister of Health and Long-Term Care.
Minister of Health and Long-Term Care.
Well, thank you, Mr. Speaker, and I want to commend the member from Kitchener-Conestoga. He has been a tireless advocate on behalf of individuals in this province who do have rare diseases, and their families and their communities, and he's done important work. And Mr. Speaker, I was proud earlier this week to meet with many individuals from across the province that do have rare disease or are advocates or family members of people with rare diseases, and it's clear that we need to continue to do more. I announced funding at University Health Network for a particular rare disease, Ehlers-Danlos syndrome, funding for a Centre of Excellence at University Health Network, and quite frankly a template that can be used because it was evolved through an expert panel that we created of clinical experts. Patients were part of that as well, of that process, where we created a template I think that will be beneficial for other rare diseases as well.
Answer.
I'm happy to speak more in the supplementals.
Thank you. Supplemental, the member from Kitchener-Conestoga.
Back to the minister. Minister, we've had people from across the province travel here today to mark their support for a united and transparent effort that will finally address rare disease suffering. Year after year, they've watched on as government has turned its back on their pleas for help. They have watched as government acknowledges their challenges with stopgap measures and one-off announcements that have only prolonged the suffering. Today, I'm proposing an all-party select committee process which every one of these people and the hundreds of thousands they represent are prepared to stand by.
Fair to me.
Minister, will you stand with them?
Very good.
Thank you. Minister.
Well, Mr. Speaker, one of the other aspects of the announcement on Monday, and I have to commend among others, the Canadian Organization for Rare Disorders that convened the day on Monday, where many individuals, family members and advocates on behalf of individuals with rare disease came to Queen's Park. I met with them and talked with them about another important initiative that this government has taken, building on the work that we've done through the expert panel on Ehlers-Danlos syndrome. We are creating a working group, Mr. Speaker, that will be focused solely on provincial efforts for rare diseases. It will be comprised of clinical experts, experts in the field. It will be comprised of patients and patient advocates as well, so that we can work on those fundamental issues of prevention, detection, providing the appropriate supports, access to drugs as well, all of the elements that are important as a government that we should be providing for these individuals. And I'm happy to speak more once again in the supplemental that I know that is coming.
Final supplementary.
You get an answer. I didn't hear an answer yet.
Minister, your working group announcement earlier this week was an acknowledgement of the need for government response to the heart-wrenching struggles inaction has allowed to fester for too many years. Later today, you will have the opportunity to build on that acknowledgement by supporting the open, all-party select committee process that has proven successful in leading to informed recommendations that demand government's response. Minister, don't turn your back on rare disease sufferers. Will you support my motion today, yes or no?
Hear, hear.
Thank you. You seated, please. You seated, please. Thank you. Minister.
Well, thank you, Mr. Speaker, and I think those that have rare diseases and disorders would agree that it's important to have a working group to begin action now, Mr. Speaker, to bring together clinical experts, to bring together patients and patient advocates, to begin to take concrete steps like we did earlier this week in announcing the Centre of Excellence for a rare disease, Ehlers-Danlos syndrome. Quoting the Canadian
Merci.
After the government's announcement, the CORE, the Canadian Organization for Rare Disorders, said today on International Rare Disease Day, the Canadian Organization for Rare Disorders welcomes the announcement made by Ontario Health Minister Eric Hoskins to open a new clinic, which could be expanded to other rare disorders, as well as his commitment to strike a working group to develop an Ontario approach to a coordinated provincial healthcare system for patients with rare disorders. Thank you.